Hey everyone, and welcome to another Deep Dive. Today, we're all about those oh no moments, medical emergencies. We're going to be looking at a nurse assistant training module from a California community college, and we're going to be pulling out those gotta know it tips that everyone can use.
Yeah, think of it as like a crash course, but hopefully without the actual crashing part.
Right, exactly. We're not trying to turn you into paramedics or anything, but even just a little knowledge can, well, it can make a huge difference in those moments when every second counts. And this module, it starts with a whole bunch of medical terms. Some of them I'm sure you've heard before, like cardiac arrest, which, by the way, is a leading cause of death in the U.S. Pretty scary stuff.
Yeah, it really emphasizes why it's so important to understand these terms, right? Because when you're in a stressful situation, being able to communicate clearly can literally mean the difference between life and death.
Okay, so cardiac arrest, that's when the heart basically stops, right? No beat, no pulse, no blood flowing. Got it. But then there's this word, syncope, which sounds like something out of Shakespeare or something.
It does sound kind of dramatic, but really it just means fainting. You know, sudden drop in blood pressure, feeling lightheaded, maybe you even pass out, hit the floor. That's syncope.
So less Romeo and Juliet, more like, whoops, skip breakfast kind of situation.
Sometimes, yeah, that's all it is. But it can also be a sign of something more serious going on, so it's always a good idea to get it checked out just in case. And then there's hemorrhage, and we're not talking about little paper cuts here.
Oh yeah, I'm imagining more like a busted fire hydrant, water spraying everywhere except it's blood inside the body.
That's a pretty vivid image, but yeah, that's the gist of it. Hemorrhage means severe bleeding, whether it's internal or external. And if it's not controlled quickly, it can be really dangerous, even life-threatening.
Okay, enough of the blood and guts stuff. Let's move on to something a little less, scary. I'm sure we've all had those moments where we go too long without eating, get all shaky and lightheaded. That's basically what hypoglycemia feels like, right?
Exactly. Hypoglycemia just means low blood sugar, and it's something we see a lot, especially in people with diabetes. The good news is it's usually pretty easy to treat, just need a little sugar boost.
Huh. So a sugary snack can actually be a lifesaver. You learn something new every day.
Yeah.
All right, let's dive into some of those more serious emergencies, the kind that can escalate super fast. We're talking heart attacks, strokes, seizures, things like that. Recognizing the early signs can make a huge difference in how things turn out.
For sure. And the thing is, those signs aren't always as dramatic as what you see in movies. You might think of a heart attack as that classic clutching the chest scenario, but some people experience more subtle symptoms, like pain that radiates down the arm or jaw or even back pain. Some folks even mistake it for heartburn.
Wait, seriously? So indigestion could actually be a heart attack in disguise. That's terrifying. What about strokes? I've heard there's an easy way to remember the warning signs, something about FAST.
You got it. FAST. It stands for face drooping, arm weakness, speech difficulty, and T for time to call 911. It's a great tool for remembering the key signs of a stroke. Super simple, but super effective.
And with strokes, time really is of the essence, right? I remember reading this story about a woman who had a sudden, really bad headache, but just brushed it off, thinking it was nothing serious. It turned out to be a stroke. And because she waited so long to get help, the damage was way worse than it could have been.
That's why it's so important to always err on the side of caution. If you're ever unsure, just call for help. Better safe than sorry, right?
Yeah.
And this module, it talks a lot about those crucial moments before the paramedics get there, those immediate interventions that can make a world of difference.
Right, because we're not teaching anyone to be a paramedic here. But there are things you can do, even simple things that can help buy some precious time.
Exactly. The module really stresses the importance of staying calm, calling for help immediately, reassuring the person who's in distress, just making them feel safe and supported. And also knowing where to find emergency equipment, like those AEDs you see everywhere these days.
The AEDs, right, those automated external defibrillators. I gotta admit, I've seen them around, but I wouldn't have a clue how to use one.
That's where proper training comes in. But even just knowing that using a defibrillator early on can dramatically increase someone's chances of surviving a cardiac arrest, that's a powerful piece of knowledge in itself.
It really is. Speaking of life-saving interventions, I noticed something kind of interesting about CPR in this module. Apparently, they've changed the sequence from ABC, airway, breathing, circulation, to CAB, compressions, airway, breathing. Why the switch up?
It's actually super interesting. Research has shown that starting with chest compressions is more effective at getting that oxygen-rich blood flowing to the brain and vital organs.
So it's all about getting that blood pumping ASAP. Makes sense.
Exactly. It's a small change, but it makes a big difference in how we respond to cardiac emergencies.
Okay, this deep dive is already blowing my mind. But before we move on to some of the more hands-on stuff, we got to talk about something that's practically a movie cliche, the Heimlich maneuver. I've seen it done a million times on screen, but I have a feeling Hollywood doesn't always get it right.
You're probably right to be skeptical. Those movie scenes might be entertaining, but they often oversimplify or even completely misrepresent how to actually do this life-saving technique.
So it's more than just giving someone a squeeze.
Oh, definitely. The module breaks down the correct technique for abdominal thrusts, which is the core of the Heimlich maneuver. It's about applying firm upward thrusts to the abdomen, just below the rib cage. The goal is to create enough pressure to force that obstruction out of the airway.
Sounds like you need to have some upper body strength for that.
You do need a bit of force, which is why proper training is so important. Practicing on a mannequin is the best way to get the technique down and make sure you're applying the right amount of pressure.
I read this story about a teenager who used the Heimlich maneuver to save his friend from choking. It's amazing how just knowing the right technique can turn anyone into a hero.
It just shows you the power of being prepared. You never know when you might need to use these skills.
Speaking of being prepared, let's decode some of that hospital lingo. Have you ever wondered what those emergency codes they announce over the PA system actually mean? It's like a secret language, isn't it?
It is, kind of, but each code has a very specific purpose. It's all about making sure the hospital staff can respond quickly and efficiently to different situations.
All right, pop quiz. What does code red mean?
Code red means fire. It triggers a whole series of actions to keep everyone in the building safe, patients, staff, visitors, everyone.
Makes sense. What about code blue? I feel like I always hear that one in medical dramas.
Code blue usually signals a cardiac or a respiratory arrest, which means someone's in immediate danger and needs CPR. A rapid response team will rush to the scene with all the equipment and expertise they need to try and save that person's life.
Wow, that's intense. Definitely not something you want to hear in real life. What about code yellow? Does that mean like a hazardous materials situation?
Not quite, but it does indicate a potential threat. Code yellow often means there's a bomb threat or some other kind of security risk. It means they need to activate specific safety protocols.
So if you hear code yellow, stay put and follow instructions.
Exactly. Hospital code systems might vary a little from place to place, but the main idea is the same. It's about making sure there's a rapid, coordinated response to any critical situation.
So there you have it. You can now impress your friends with your insider knowledge of hospital lingo. But keep in mind, this is just the tip of the iceberg. Stay tuned for part 2, where we'll go even deeper into some specific skills and interventions that can help you take charge when an emergency strikes.
All right, welcome back to our deep dive into emergency procedures. Hope you guys are ready for more because we're going to get a little more hands-on this time.
Yeah, let's do it. We've covered the lingo, we've talked about those warning signs, but now let's get to the real deal. What can WE actually do in those crazy moments before help arrives?
I'm glad you asked. This training module actually gives some really good guidance. So let's start with heart attacks. We all know about chest pain, but what other signs should we be on the lookout for?
Well, the module talks about things like shortness of breath, sweating, feeling nauseous, and even like a sense of impending doom, like something is seriously wrong. It's not always that super obvious clutching the chest thing, huh?
Nope, not always. And that's what makes it tricky. But the main takeaway here is that even if you're not 100% sure, it's always better to be safe than sorry. Those symptoms, especially if they come on suddenly, call 911, don't even hesitate.
Okay, call first, figure it out later. Got it.
Yeah.
But while you're waiting for the ambulance, what can you do to help the person who's having the heart attack?
The module suggests focusing on keeping them calm and comfortable. Loosen any tight clothing, help them find a comfortable position, and just reassure them that help is on the way. Sometimes just having that peace of mind can make a world of difference.
Yeah, creating that calm in the middle of chaos. I like that. Okay, what about strokes? We talked about the FAST acronym before, but what do you do after you've noticed the signs and made that 911 call? Is there anything you can do immediately?
The most important thing is to stay with the person. Keep an eye on them, make sure they're comfortable, and just keep reassuring them that help's coming. But honestly, beyond that, less is more. Don't try to play doctor unless you actually are one. And definitely don't give them any medication unless a medical professional tells you to.
Got it. Be the calm in the storm, but don't try to be a hero. Now, seizures. Those can be pretty scary to witness.
Yeah.
What are the do's and don'ts in that situation?
The module is all about safety first when it comes to seizures. If you can, gently ease the person to the ground so they don't hurt themselves while they're seizing. Make sure the area around them is clear of any furniture or anything that could be dangerous. And this is super important, never put anything in their mouth.
Wait, really? Why not? I always thought that was to keep them from biting their tongue.
It's a common misconception, but it's actually more likely to harm them than help. You could accidentally damage their teeth or even block their airway, which is the last thing you want.
Okay, makes sense. So protect them, but don't restrain them.
Got it. Okay, let's talk about shock. I know it can be caused by all sorts of things, injuries, allergic reactions, even really bad news. How do you even know if someone is going into shock?
Okay, here's the need to know without getting too technical. Their skin might be pale and clammy. Their pulse is racing but weak. They might be breathing really fast, and they could seem confused or disoriented. Weakness, dizziness, nausea, those can all be signs too. It's basically like their body's circulatory system has gone haywire. That sounds serious. What's the first thing you should do if you think someone's in shock?
Call 911. That's always the first step. Then, while you're waiting for help to arrive, the module recommends laying the person down flat and, if you can, elevating their legs. This can help get blood flowing back to their heart and brain, which is super important. Keep them warm, keep them comfortable, and if they're conscious, just keep reassuring them that help is on the way.
Elevate legs, warmth, stay calm. Got it. All right, let's shift gears to something a little less intense but still requires quick action. Choking. We talked about the Heimlich maneuver earlier, but is that always the right thing to do?
Great question. The module makes it very clear that abdominal thrusts, the Heimlich maneuver, should only be used when someone is truly choking. That means they can't cough or speak. If they're coughing forcefully, that means air is still getting through, so just encourage them to keep coughing.
So don't interrupt a productive cough. But what if they are coughing but it's not doing anything?
If it seems like whatever's stuck isn't coming loose, or if they're starting to turn blue or lose consciousness, that's when you need to step in with the abdominal thrusts.
How do you know you're using the right amount of pressure? It seems like it would be easy to accidentally hurt someone.
That's a valid concern, and it's exactly why proper training is so important. The key is to use enough force to create that burst of air from the lungs, aiming upwards towards the diaphragm. Think of it like helping them create a super-powered cough from the outside.
Okay, so a controlled upward thrust. Got it. Now, the module also mentioned something called chest thrusts. When would you use those instead of abdominal thrusts?
Chest thrusts are a good alternative for people who are pregnant or have a larger build, since getting your arms around their abdomen might be tricky. The technique is basically the same, but you're applying those thrusts to the center of their chest instead.
Interesting. Good to know there are options. Now, let's go back to calling 911, which is something that comes up a lot. What information should you be ready to give the dispatcher? I'm assuming they're going to need more than just help. It's an emergency.
You're absolutely right. The module really stresses the importance of staying calm and speaking clearly when you call 911. Be prepared to give your exact location. Don't be vague, be specific. Then give them a quick rundown of what's happening, whether it's a heart attack, a seizure, whatever it is. The person's age and gender are helpful too. And if you know any relevant medical history like allergies or pre-existing conditions, make sure to mention that as well.
It makes sense. Time is of the essence, so having those details ready can really help things move faster.
Absolutely. Oh, and one more thing. Don't hang up until the dispatcher tells you to. They might have more questions for you or give you specific instructions to follow.
Okay, we've covered a lot of ground here. We've talked about recognizing the signs, taking action while you're waiting for help, and making sure that 911 call is effective. But what about after an emergency? Is there any people should know about in terms of support or follow-up care? It's not just over once the ambulance leaves, right?
You're hitting on a really important point that often gets overlooked. It's so crucial to remember that even after the immediate crisis has passed, there can be lingering effects, both physically and emotionally.
You mean like trauma?
Yeah, trauma is a very common response to a medical emergency, whether you were the one who experienced it firsthand or you just witnessed it happening. Anxiety, flashbacks, trouble sleeping, difficulty concentrating, these can all be signs that someone is struggling with trauma.
So what can people do to deal with those feelings? I imagine just bottling it up isn't a healthy solution.
Talking to a mental health professional can be a huge help. They can give you tools and strategies for processing and managing those tough emotions. Support groups, especially ones specifically for trauma survivors, can also be incredibly valuable. Finding a community of people who understand what you're going through can make a world of difference.
Makes sense. Taking care of the emotional impact is just as important as addressing the physical injuries. Now, let's talk about something that can be a little mysterious and maybe even a little scary. Advance directives. I know they're important legal documents, but to be honest, I'm not exactly sure what they entail. Can you break it down for us?
Absolutely. Think of advance directives as a way to give instructions for your medical care in case you're ever unable to make those decisions yourself. It's basically like having your voice heard even when you can't speak for yourself.
So it's about staying in control of your health care, even in the worst case scenario.
Exactly. There are a few different types of advance directives, each with its own specific purpose. One of the most common ones is called a living will.
Okay, the living will. I've heard of that, but what does it actually say?
A living will outlines your preferences for life-sustaining treatments, things like CPR, being put on a ventilator, or having a feeding tube in case you're terminally ill or permanently unconscious.
So it's kind of like a roadmap for end-of-life care, making sure your wishes are respected.
Precisely. It helps ensure that your medical decisions align with your values and beliefs, even when you can't communicate them directly. Speaking of respecting someone's wishes, have you ever heard of a do not resuscitate order or a DNR?
Yeah, the DNR. That one feels a lot heavier for some reason. So it's basically choosing not to have CPR or other life-saving measures if your heart stops.
That's right. And it's a very personal decision, often made by people with serious illnesses who want to avoid aggressive medical interventions at the end of their life.
Wow, this is getting pretty deep. But honestly, I already feel so much more prepared just from having this conversation.
That's what we're here for, to give you the knowledge and tools you need to navigate these situations with confidence and clarity.
Well, you're definitely doing that. But hang on tight, everyone, because we're not done yet. Stay tuned for part 3, where we'll dive into some real-life stories that show all these principles in action, proving that heroes aren't just found in movies. Don't go anywhere. And we're back for the final part of our deep dive into emergency procedures. We've talked about all the technical stuff, the what-to-dos, the warning signs, but now I want to talk about real-life situations because, well, knowing the theory is one thing, but seeing how it all works in action, that's where it gets really interesting, right?
Oh, absolutely. Real-life examples are so powerful because they show us that all the stuff we've been talking about, it's not just hypothetical, it can actually make a difference.
Yeah, like heroes, they're not just in movies, they're everyday people who know what to do when things go sideways. Speaking of which, I came across this story, and it really shows how knowing those signs of distress can be a game changer. Remember the FAST acronym for strokes?
Oh, yeah. Face drooping, arm weakness, speech difficulty, time to call 911. So simple, but it can literally save a life.
Well, this story is a perfect example. Imagine this. A young woman, let's call her Sarah. She's having breakfast with her family when she notices her dad's face is kind of, well, it's drooping on one side, and he's having trouble speaking clearly. Sarah, she had taken a first aid course a while back, and bam, that FAST acronym pops into her head. She realizes her dad is probably having a stroke, so she calls 911 right away.
Wow, that's amazing.
I know, right? And because she acted so quickly, her dad got the medical attention he needed and ended up making a full recovery.
It's incredible how something as simple as remembering an acronym can have such a huge impact. Early recognition and quick action, that's what it's all about.
Totally.
Yeah.
It just shows you that knowledge is power,
Right.
especially when it comes to emergency situations. Okay, next story. This one is all about staying calm under pressure, which I think we can all agree is easier said than done, especially when you're dealing with something like a choking incident or someone having a heart attack.
Oh.
I read this amazing story about a flight attendant who had to use the Heimlich maneuver on a passenger who was choking mid-flight.
Oh, wow. Those flight attendants, they're trained for everything, aren't they?
They really are. And in this case, the flight attendant's quick thinking and calm demeanor saved the day. The passenger was able to cough up whatever was stuck, and he could breathe again. All thanks to that flight attendant who knew exactly what to do and didn't freak out.
Talk about a hero in the sky. It shows that even when things are super stressful, keeping your cool and focusing on the task at hand is so important.
Absolutely. Okay, this next one really highlights how crucial clear communication can be, something we often take for granted. There was this group of hikers. They were pretty far out in the wilderness, barely any cell service, and one of them got seriously injured. They managed to get a signal and call 911. The dispatcher, even though the connection was terrible, was able to walk them through some basic first aid while they waited for the rescue team.
Oh man, I bet those hikers were so thankful for that guidance. In those situations, knowing that someone is there to help, even if they're not physically present, can be a huge relief.
Totally. And what struck me about this story was that the dispatcher kept stressing how important it was for the hikers to give clear and concise information about their location and what kind of injury they were dealing with. Because they were able to communicate effectively despite the bad signal, the rescue team found them quickly and got them the medical care they needed.
That's a good reminder for all of us, really. We should all know how to accurately describe our location, even if we're just going for a walk in the park. You never know when that info might be life-saving.
So true. Okay, this next story is one that I think a lot of people can relate to, dealing with a medical emergency involving a loved one. This one is about a man who had to perform CPR on his wife when she suddenly collapsed at home.
Oh, wow, that must have been terrifying.
It was, but luckily, he had recently taken a CPR course. He was able to keep her heart beating until the paramedics arrived. The doctor said that what he did made all the difference. It's amazing how learning a skill like CPR can empower you to help the people you love, even in the scariest moments.
It really drives home the point that anyone can learn CPR, no matter what their background is. You don't have to be a medical professional to potentially save someone's life.
I agree. Okay, one last story, and this one brings us back to the idea of advanced directives. It's about a woman with a terminal illness who had a living will in place. It clearly stated that she didn't want any life-sustaining treatment if her condition got worse. And when it did, her family, even though they were heartbroken, they honored her wishes. They let her pass away peacefully without any unnecessary medical intervention.
That must have been such a hard decision for them to make, but it sounds like they were respecting her wishes, and that's really beautiful.
It was a difficult but ultimately loving and respectful decision. And it really emphasizes why it's so important to have those sometimes tough conversations with our loved ones about end-of-life care. It might not be easy, but knowing what they want can bring so much peace and clarity during what is already an incredibly difficult time.
Yeah, it reminds us that advance directives aren't just about legal documents. They're about respecting someone's autonomy and ensuring that their voice is heard, even when they can't speak for themselves.
Well, that about wraps up our deep dive into emergency procedures. We've covered so much, from deciphering medical jargon to learning life-saving techniques, even exploring the complexities of advanced directives. It's been a wild ride, but I hope it's been as informative and empowering for you as it has been for me.
Me too. I think the biggest takeaway here is that knowledge is power. Even a basic understanding of emergency procedures can give us the confidence to handle unexpected situations and potentially make a real difference.
It's all about being prepared, not just for those big dramatic emergencies, but also for those everyday situations where knowing what to do can have a real impact.
And remember, this deep dive was just the beginning. There's a whole world of resources out there for anyone who wants to learn more about emergency preparedness and first aid. Keep learning, keep exploring, and stay safe out there.
Couldn't have said it better myself. Until next time, stay curious.